If you're over 60, what I'm about to tell you could save your life, and I mean that literally. Because right now, at this very moment, your body might be sending you warning signals that a stroke is coming. And here's the scary part. Most seniors completely ignore these signs because they don't recognize them for what they are. This isn't about dramatic symptoms like collapsing or losing consciousness. This is about the subtle, quiet warnings that appear days, weeks, or even months before a major stroke hits. And if you catch them early, you can stop a stroke before it destroys your brain, steals your independence, or ends your life. Neurologists at Johns Hopkins say that nearly 80% of strokes are preventable if you know what to look for. But the problem is, most people dismiss these early warning signs as just normal aging. They think it's nothing. They think it'll pass. And that mistake costs them everything. For decades, doctors told us that strokes happen suddenly, without warning, like a bolt of lightning. But new brain imaging technology changed everything. Researchers discovered that the brain actually sends distress signals long before a major stroke occurs. These are called silent strokes and transient ischemic attacks, and they're your body's way of screaming for help. The question is, are you listening? Here are the 7 warning signs of stroke that seniors ignore. And I'm begging you, if you recognize even one of these in yourself or someone you love, take it seriously. Warning sign number 1, sudden weakness or numbness that comes and goes. You wake up one morning and your left hand feels a little tingly. Maybe your leg feels heavy. It lasts for a few minutes, maybe an hour, and then it goes away. So you brush it off. You think maybe you slept funny. Maybe it's arthritis acting up. But here's what's really happening. A blood clot is temporarily blocking blood flow to part of your brain. When the clot dissolves or moves, the symptoms disappear. But that clot is a warning. It's telling you that your blood vessels are in trouble. It's telling you that a bigger, more permanent stroke could be just around the corner. A study published in the New England Journal of Medicine found that people who experience these temporary episodes of weakness or numbness are 9 times more likely to have a major stroke within 90 days. 9 times. And yet most people never mention it to their doctor because the symptoms went away and they think that means everything's fine. It's not fine. This is your brain waving a red flag. And if you ignore it, the next time might not be temporary. The next time, that weakness could be permanent. The next time, you might not be able to walk, dress yourself, or even speak. So if you've had any sudden numbness or weakness, even if it only lasted a few minutes, you need to call your doctor today, not next week, today. But warning sign number 2 is even more dangerous because most people don't even realize it's connected to stroke risk at all. Warning sign number 2, sudden vision problems in one or both eyes. You're reading the newspaper and suddenly everything goes blurry in your right eye. Or maybe you lose vision completely for a few seconds, or you see double, or it feels like a curtain is being pulled down over your eye. Most seniors think this is just their eyes getting worse with age. They blame it on cataracts or needing new glasses. They figure they'll mention it at their next eye appointment in 6 months. But neurologists say this is one of the most overlooked stroke warning signs. When blood flow to the part of your brain that controls vision gets interrupted, even briefly, your eyesight suffers. And if blood isn't getting to your visual cortex, it's not getting to other critical parts of your brain either. The American Stroke Association reports that sudden vision loss or changes, especially in just one eye, can indicate a mini-stroke affecting the retinal artery or the occipital lobe of your brain. And here's the terrifying part. These vision episodes often happen in the days or weeks before a massive stroke that causes permanent brain damage. I'm going to tell you something that might scare you, but you need to hear it. If you suddenly lose vision in one eye, even for just 30 seconds, you have a medical emergency. You need to get to a hospital immediately, because that brief episode could be followed by a full stroke within hours. Don't wait. Don't assume it's just your eyes. Your brain is crying out for oxygen, and time is everything. But the next warning sign is one that almost every senior experiences, which is exactly why it's so dangerous. They think it's just part of getting older. Warning sign number 3. Sudden severe headaches that feel different from your normal headaches. Maybe you've had tension headaches your whole life. You know what they feel like. But then one day you get a headache that feels different. It comes on suddenly. It's more intense. It's in an unusual spot. Maybe it's accompanied by nausea or sensitivity to light. And you think, well, headaches happen. You take some aspirin and go about your day. But a sudden, severe headache that's different from your usual pattern can be a warning sign that something is seriously wrong with the blood vessels in your brain. It could mean you're having a mini stroke. It could mean you have a blocked artery. It could even mean you have a small bleed in your brain that's about to get much worse. Harvard Medical School researchers found that people who experience sudden, unexplained severe headaches are at significantly higher risk for hemorrhagic stroke, which is when a blood vessel in the brain ruptures. This type of stroke is less common than the kind caused by blockages, but it's far more deadly. Nearly half of people who have a hemorrhagic stroke die within 30 days. Now, I'm not saying every headache is a stroke. But if you get a headache that feels like the worst headache of your life, or if your headache pattern suddenly changes and you can't explain why, you need to get checked out immediately. Your brain doesn't have pain receptors, so it can't hurt, but the blood vessels and membranes around your brain can. And when they're screaming with pain, they're telling you something is very, very wrong. Do not ignore sudden, severe, or unusual headaches. They could be your last warning before disaster strikes. But what I'm about to tell you next might be the most important warning sign of all, because it affects your ability to get help when you need it most. Warning sign number 4. Sudden confusion, trouble speaking, or difficulty understanding others. You're having a conversation with your spouse and suddenly you can't think of a simple word, or you try to say something and it comes out garbled, or someone is talking to you and you can't understand what they're saying, even though you can hear them perfectly. Most seniors brush this off as a senior moment. They laugh it off. They say, "Oh, I'm just having a foggy day." But sudden difficulty with language, whether it's speaking, understanding, or finding words, is one of the hallmark signs of a stroke in progress or a stroke that's about to happen. It means blood flow to the language centers of your brain is being disrupted. The National Institute of Neurological Disorders and Stroke says that speech and comprehension problems are among the most common early warning signs of stroke, and here's why this one is so critical. If you can't speak or understand language, you can't call for help. You can't tell someone what's wrong. You might not even realize you're having a stroke. I want you to imagine this scenario. You're home alone. You suddenly feel confused and you try to call your daughter, but you can't remember how to use your phone. Or you dial the number, but when she answers, you can't form words. You make sounds, but they don't make sense. She thinks you're joking or that the connection is bad, so she hangs up. And you're left there, unable to communicate, while a stroke is destroying your brain cell by cell. This is not a hypothetical. This happens to seniors every single day. And by the time someone realizes what's happening, it's often too late to prevent permanent damage. So here's what I want you to do right now. Teach yourself and your loved ones the FAST test: face drooping, arm weakness, speech difficulty, time to call emergency services. If you or anyone around you shows even one of these signs, you call for an ambulance immediately. You don't wait. You don't see if it gets better. You act. Because every minute that passes during a stroke, your brain loses nearly 2 million neurons. 2 million, every single minute. But the next warning sign is so subtle that even doctors sometimes miss it. And that's exactly what makes it so deadly. Warning sign number 5. Sudden dizziness, loss of balance, or trouble walking. You stand up and the room spins. You feel unsteady on your feet. You reach for the wall to catch yourself. Or maybe you're walking and suddenly your legs don't want to cooperate. You feel like you might fall. And you think, well, I'm getting older. Balance gets worse with age. Maybe my blood pressure dropped. Maybe I stood up too fast. But sudden, unexplained dizziness or loss of coordination can mean that blood flow to your cerebellum, the part of your brain that controls balance and movement, is being compromised. It can also indicate that you're having a stroke in your brainstem, which controls vital functions like breathing and heart rate. A study in the journal Stroke found that dizziness is present in nearly half of all stroke patients, but it's frequently dismissed as vertigo or an inner ear problem. Seniors go to their regular doctor, get treated for vertigo, and meanwhile their stroke risk is getting worse by the day. Here's how you tell the difference. If your dizziness comes on suddenly, if it's severe, if it's accompanied by any other symptom on this list like numbness, vision problems, or headache, you cannot afford to wait. That's not just dizziness. That's your brain being starved of oxygen. And here's another thing. Falls are incredibly dangerous for seniors. If you fall because of a balance problem caused by a mini stroke, you could break a hip, fracture your skull, or cause internal bleeding. And then you're dealing with a stroke and a traumatic injury at the same time. I've seen too many families lose a loved one because they thought grandma just lost her balance. They didn't realize her brain was failing. So please, if you experience sudden dizziness or coordination problems, especially if they come out of nowhere, get to a doctor or emergency room immediately. Your life might depend on it. But now we're getting to the warning signs that are so sneaky, so easy to dismiss, that they slip past almost everyone. And that's exactly why they're so dangerous. Warning sign number 6. Sudden extreme fatigue or exhaustion that doesn't match your activity level. You wake up after a full night's sleep and you feel absolutely wiped out. Or you're going through your normal day and suddenly you feel like you've run a marathon. Your body feels heavy. Your brain feels foggy. You just want to lie down. Seniors almost always blame this on age, on not sleeping well, on doing too much the day before. But what they don't realize is that sudden, unexplained fatigue can be a sign that your brain isn't getting enough oxygen. Your body is working overtime to compensate for reduced blood flow, and that leaves you feeling drained. Research from the American Heart Association shows that extreme fatigue, especially in women over 60, is frequently reported in the days and weeks before a major stroke. It's your body's way of telling you that something is seriously wrong. Your cardiovascular system is struggling, your brain is struggling, and your body is exhausted from trying to keep everything running. But here's the problem. Fatigue is so common in older adults that nobody takes it seriously. You mention it to your doctor and they say, well, you're 70, of course you're tired. And they send you home. Meanwhile, your arteries are clogged, your blood pressure is through the roof, and you're a ticking time bomb. If you experience sudden, severe fatigue that can't be explained by your activity level, especially if it's combined with any other warning sign on this list, you need a full cardiovascular workup. You need blood work. You need imaging. You need someone to take you seriously and figure out what's going on before it's too late. Do not let anyone tell you that feeling exhausted all the time is just part of aging. Yes, energy levels decline as we get older, but sudden, dramatic fatigue is not normal. It's a warning. And now, the final warning sign. This is the one that surprises even neurologists because most people have no idea it's connected to stroke risk at all. Warning sign number 7. Sudden changes in mood, personality, or cognitive function. You've always been patient and calm, and suddenly you're irritable and snapping at everyone. Or you've always been sharp as a tack, and now you're forgetting things, losing track of conversations, or feeling confused about things that used to be second nature. Family members notice. They say, you're not acting like yourself, but everyone assumes it's stress, or depression, or maybe early dementia. But what they don't realize is that small, repeated strokes can cause changes in the brain that affect mood, behavior, and thinking. These are called silent strokes, and they're far more common than most people think. Studies show that nearly 1 in 4 people over the age of 65 has had at least one silent stroke without even knowing it. Each time a silent stroke happens, a small part of your brain dies. Over time, these mini injuries add up. They affect your memory. They affect your emotions. They change who you are. And here's the heartbreaking part. By the time someone finally gets diagnosed with vascular dementia, which is dementia caused by repeated strokes, the damage is already done. The brain tissue is gone. It can't be brought back. But if you catch the warning signs early, if you recognize that sudden mood changes or cognitive decline might be stroke-related, you can take action. You can get on medication to prevent future strokes. You can make lifestyle changes. You can stop the progression before it steals your mind. Neurologists at the Mayo Clinic say that any sudden change in personality, mood, or thinking ability in someone over 60 should be evaluated for vascular problems. It's not just aging. It's not just depression. It could be your brain sending an SOS signal. So if you or someone you love has been acting differently lately, if their memory has gotten noticeably worse, if their mood has shifted in ways that don't make sense, please get them checked. It could save their brain. It could save their life. Now, here's what I want you to understand. All 7 of these warning signs have one thing in common. They're easy to dismiss. They're easy to ignore. They seem like small, unimportant things, but they're not. Every single one of them is your body trying to tell you that your brain is in danger. And here's the good news. If you catch these warning signs early, stroke is preventable. With the right medication, the right lifestyle changes, and the right monitoring, you can dramatically reduce your risk. But only if you take action now. Don't wait until you have a major stroke. Don't wait until you lose your ability to walk, talk, or think. Don't wait until it's too late. If you've experienced even one of these warning signs, call your doctor today. Insist on being taken seriously. Ask for a stroke risk assessment. Get your blood pressure checked. Get your cholesterol tested. Get imaging of your brain and blood vessels if necessary. Your life is worth fighting for. Your independence is worth protecting. And your brain is the most precious thing you have. Don't let these warning signs slip by, because the stroke you prevent today could be the one that saves everything you hold dear. And if you want to protect your heart and brain even further, don't skip the next video. Your future depends on what you do right now.